We'll now move on to the second discussion of this webinar about benefits and funding support for unpaid carers. We'll first hear from Lisa, who has been an unpaid carer for the last 20 years. She's also part of our lived experience panel and has been involved in planning this webinar. So over to you, Lisa.
Great, thanks, Emma. I've been the main carer for my relative for over 20 years. It's a role I've had to do mainly on my own, with very little support, and it's been extremely difficult to manage. They've been on disability benefits for all that time, mainly personal independence payments and ESA, employment and support allowance. And now they've recently transitioned over to universal credit. I'm their appointee for benefits, which means I'm legally responsible for them. I fill all the forms in, arrange all the evidence, send it all off, etc. It's not an easy process to do, especially as a third party. And it's very time consuming and stressful. The forms are very complicated and lengthy, and the point scoring system that is used for benefits, especially with PIP, is confusing. When I've looked at some of the scores in past claims, none of it makes any sense, and points weren't awarded in the categories that I think they should have been. I think this is quite common and is something I've heard a lot of carers and service users complain about. It almost feels like a lottery or just plain luck as to whether people will actually be awarded the money that they're entitled to. The uncertainty of a disability benefit is also a worry for the carer, because if the cared for loses their entitlement to PIP or attendance allowance, then the carer also loses their entitlement to carer's allowance. This means that they may be forced back into looking for paid work and so cannot continue their caring role to the same degree. So the whole process of applying for disability benefits is extremely stressful for everyone concerned. Another issue that I experienced is that if you do claim carer's allowance for a person that lives alone, they would lose their severe disability premium if they are receiving employment and support allowance. So in my experience, the whole system is very unfair. In the past, I've managed to stay in a part-time job alongside my caring role. This was for around 12 years. And this was really only because my employer was very understanding and flexible around my caring role. And so when appointments or crises arose, which they very often did, I knew that I could take time off and catch up with work at my convenience. Now, I know not all jobs are like that, and it can be very difficult for carers to manage both working and caring together. I found it very unfair that even though I was juggling both roles, that is caring and working, if I earned over a certain weekly amount, then I could not claim carer's allowance. And even if you do claim carer's allowance, that means you're looking after somebody for the same amount of hours as a full-time job, 35 hours a week. You would receive just £83.30 per week, which for 35 hours of caring works out about £2.50 an hour. And you also don't get paid any extra if you're caring for more than one person, which a lot of people are. This just indicates to me how little carers are valued by the government, the inequalities they face, and why lots of carers are on the poverty line. When my job ended last year, I had to apply for benefits myself, and it was a massive drop in income, which has been very difficult to deal with. I went to the benefits service at Carers Manchester, and Michael helped me work out which benefits I was entitled to and check that I was getting the right amount. He also advised me about other help, such as council tax benefit and carers allowance. The Carers Manchester contact point can also advise you about any other available council hardship grants, such as ones for white goods or utilities. I've also learned that water and utility companies can lower monthly payments for people that are struggling, and they can give grants such as the Warm Homes discount. There are also social tariffs for mobile phones and broadband providers if you receive certain benefits. Citizens Advice is another organisation that can also check your benefit entitlement. The benefits you receive as a carer are very hard to live on, and it's a struggle for many of us to pay our bills. One thing I wished I'd known earlier on in my caring role was about my entitlement to a carer's assessment. I think I was a carer for many years before someone actually told me about it. Through that assessment, I learned what support was available to me, and through that, I qualified for the one-off yearly carer's payment, which helps me take a break or spend on something that helps me cope with the caring role, such as a massage or a pampering session or a haircut, something like that. They also put me in touch with other relevant services, such as Carers Manchester. One question I would like to ask Michael is about the proposed changes that the government is bringing in next year around disability benefits and the reforms to PIP and the work capacity assessments. A lot of carers and service users will be worried about this now. Is there any information you could give us at this time that could help ease some of the anxiety around this? Thank you.
Great. Thank you, Lisa, for sharing your experiences. It was really insightful and really quite frustrating to hear about the things you've had to deal with. But I'm glad to hear you've had some help from Contact Point, which then leads us nicely to our next speaker, who's Michael Dietrich from GADIM, who's the Welfare and Advice Team Leader at Carers Manchester Contact Point. And if anyone has any questions on this topic, feel free to add those to the Q&A or the chat, and we'll pick them up from there. Thank you.
Yeah. Hello. Am I on this? Can you see me? Yeah. Okay. I just start talking. Hello. I'm Michael, and I'm the team leader of the Welfare and Benefits Advice team at Carers Manchester. We are a team of two, myself and Amy, who couldn't be here today. And before I respond to your question, Lisa, I will quickly outline what we do in terms of benefits advice at Carers Manchester. So we do benefit entitlement checks for households, including all household members, so not only carers or the cared for, everyone, because the household as a full unit counts, to optimize their income from benefits, including advice on support with wider schemes related to benefits. And we provide form filling support, including PIP, so we can explain the scoring system or help just complete the form. We help making phone calls to the DWP, and we help challenge decisions made by the DWP, again, including personal independence payments, mandatory reconsideration, and appeal. In the last month, so May, we contacted 64 carers, including in face-to-face meetings. And following our support, we expect each of them gained on average £22 per week. But we also go out in the community and provide one-to-one support at events, or we do group workshops on benefits. And if there is anyone listening, any professionals who work with groups of carers, or anyone who is part of an informal group of carers, get in touch if you would like to get a workshop on benefits. Now to your question, Lisa. There is not that much I can say to ease your or anyone's anxiety around the proposed changes, and I'm pessimistic about them myself, but I still collected a few things. Firstly, nothing is going to change before April 26, and the 4-point rule for PIP will be introduced from November 26 and will apply only to new claims and to award reviews. Secondly, I'm a bit optimistic because there's quite a large opposition to the suggested cuts, and there's opposition inside the parliament as well. So 27 Labour MPs say they will definitely vote against the cuts. 170 Labour MPs are unhappy with the cuts and could say no. 100 MPs of all parties signed a letter to Starmer urging him to delay the changes and rethink the proposals. And the Work and Pensions Committee, which is kind of made up of members of parliament, has also called to reconsider and delay the proposals. According to rumors in the news and on political websites, so the Lib Dems seem to be against the cuts, the SNP and the Green Party as well, and it now also seems that the Conservative Party will vote against. So if that is true, the opposition inside Parliament, if it is so big, then that means the proposal will not become law. Yeah. nobody knows what's going to happen. Another reason to be slightly optimistic is that even if it does happen, the government is discussing some kind of compromises. So one compromise offered is to allow PIP claimants who score who score a total of 12 or more points for the daily living component. That for them, they don't need to meet the new 4-point rule if they have reached a total of 12, and they can still get PIP. Even though that would make entitlement more complicated to understand, it would reduce the number of claimants losing their award. Another suggestion is to allow 6 months transitional payments to claimants who lose their daily living component award. And the third possible compromise is to trade off the suggested cuts on disability benefits with getting rid of the 2-child limit of universal credit. In terms of opposition in the charity sector and the general public, critical reports have been published by Citizens Advice, Joseph Rowntree Trust, the Resolution Foundation, Health Equity North, Martin Lewis Charity, the Money and Mental Health Policy Institute, and the Trussell Trust. I won't go into details of their reports because they are very depressing, but their findings can't easily be ignored by the Parliament. A number of protests are happening around the country, and 2 large protests happened earlier this month, one in Cardiff and one in London, where over 20,000 people attended. There are several campaigns and petitions and by you I mean anyone listening, can sign. Amnesty International have started a petition to stop the cuts, and so have Carers UK and Scope. Carers Manchester has sent out information about petitions and other ways to get involved in our fortnightly email newsletter sent out to carers. So my suggestion to deal with the suggested cuts are sign the petitions, join campaigns or demonstrations against the cuts, and contact your local MP or councillor. Or second, if needed, get in touch with us to check whether you or the person you care for may be affected by the cuts, particularly by the introduction of the 4-point rule of the daily living component of PIP.
Great. Thank you, Michael. That was really useful and interesting. We'll now move on to the Q&A. So over to you, Eve. Thank you.
Hi, so thanks Lisa and Michael for that. My first question from everyone is from Michael, which is, how long does it take to get a referral and help from your service? Oh, sorry, you're muted, Michael.
I would say on average 1 week. Sometimes it can be 1 day. Sometimes I contact carers straight away the next day. I get a referral. Sometimes it can be more than a week, but on average 1 week.
Great, thank you. Our next question is, national statistics show that carers are often in financial hardship, as we've discussed. With potential benefit cuts looming, what other financial support can carers access, and where can they find information on resources or grants available?
Grants are not something I go into very much, but there are 2 websites I give to people, and that is turntous.org.uk and disabilitygrants.org. If it's something outside of the benefit system, that would be 2 options, yes.
Great, thank you. We'll make a note of those websites and send them out to people afterwards. Another question is, do you help with completing PIP and WCA forms, or is it just advice around these? And can you also help with mandatory considerations and appeals?
Yes. So PIP, so all of those forms there are different kinds. So an initial application form, a review form, appeals, mandatory reconsideration, everything in that area we do. The only thing we haven't done yet is actually representing someone at a tribunal hearing. So that wasn't needed so far, and it's quite likely we would say no because of resources, but it could also be we say yes. But that we do everything.
Great, thank you. This is another question from the Q&A. Is there anything more that can be done to support carers who are caring for a relative in their home and working full-time in terms of educating their employer? There's the carer's passport, but it doesn't seem to have any impact. How can we educate employers on how they can support employees who are unpaid carers? For example, flexibility with taking the person they care for to appointments. Is there a guide for employers anywhere on this?
That's outside of I know that we have resources on that. So if the contact point support workers would be able to email you legal rights about you have as a carer for employment now. It's not part of my benefits advice. Sorry.
Michael, I'll come in there if that's okay.
Yeah.
But that's really helpful as well. It's a really important point. At Gaddon, we have carers policy, and we also make sure that we influence employers around how to support carers as well, and on the benefits of supporting carers. So there is more information that we can do, but a lot of it's less kind of sending an email out and more about kind of more subtly working. What we would say to any carer if they're struggling with their employer, or if they're worrying about getting employment and application and how to talk about it, just to get in touch, as Michael said, through the contact point, through Salford Carers Service and other organisations, or just directly to Gaddon, and we'll point people in the right direction.
Thank you for that, Ben. Another question is the benefit service just for the carer, or can you advise about the cared for's benefits as well?
Everyone in the household, basically. Carer, cared for. So usually when I get someone, I ask for the benefit situation of everyone in the household if they want to share that. That could be 6, 7 people if they want that. Not always, they don't always want that, but it could be anyone.
Great, thank you. Another question, kind of similar to the one before about the PIP and WCA forms. Do you have information on other services that carers may be entitled to, such as council tax support, food banks, social tariffs for phones and broadband?
Yeah, so council tax support depends on savings and income. So if it's a carer with a small income or benefits income and not a large amount of savings, they are very likely entitled to council tax support. There is also a council tax discount that is non-means tested that some carers are entitled to. The social tariffs are also income based. So if someone gets universal credit and has a small amount of earnings or no earnings, many broadband internet providers have social tariffs. United Utilities has something for they can reduce your water bills if you are in benefits and meet some other criteria as well. Yeah.
Lovely. Thank you very much, Michael, and thank you, Eve, for the Q&A. So, like I said, we will now take a short break from the discussions to do a